Hyperthyroidism, Things You Should Know, Questions and Answers, Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Hyperthyroidism, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of hyperthyroidism. Chapter 1. 1. What is hyperthyroidism? Hyperthyroidism is when there is overproduction of thyroid hormones. 2. Hyperthyroidism is also called overactive thyroid. 3. Can hyperthyroidism happen to anyone? Yes, hyperthyroidism can happen to anyone. 4. What is the main function of the thyroid gland? The thyroid gland regulates the metabolism. 5. What is metabolism? Metabolism is the way the body transforms food into energy. 6. Name 2 hormones produced by the thyroid gland. 2 hormones produced by the thyroid gland are triiodothyroxine T3 and thyroxine T4. 7. Where is the thyroid gland in the body? The thyroid gland is in front of the neck. 8. Is hyperthyroidism more common in men? No, hyperthyroidism is not more common in men. Hyperthyroidism is more common in women. 9. What are the signs and symptoms of hyperthyroidism? The signs and symptoms of hyperthyroidism are fatigue and increased appetite, bulging of the eyes, weakness, weight loss, thinning of the skin, goiter, tachycardia, palpitations, arrhythmia, sleeping difficulty, heat intolerance, diarrhea, hair loss, excessive sweating, irregular menstrual cycles, etc. 10. What is goiter? Goiter is an abnormal enlargement of the thyroid gland. Chapter 2. 1. What is tachycardia? Tachycardia is when the heart beats too fast. 2. What are palpitations? Palpitations are sensations of a pounding heart. 3. What is arrhythmia? Arrhythmia is an irregular heartbeat. 4. What are the causes of hyperthyroidism? Hyperthyroidism can be caused by thyroiditis, excess iodine intake, Graves' disease, Plummer disease, thyroid nodules, etc. 5. What is the most common cause of hyperthyroidism? The most common cause of hyperthyroidism is Graves' disease. 6. What is Graves' disease? Graves' disease is an autoimmune disorder that causes the overproduction of the thyroid hormones. 7. What is an autoimmune disorder? An autoimmune disorder is when the body destroys healthy cells. 8. Graves' disease is also called Bastow's disease. 9. What is thyroiditis? Thyroiditis is the inflammation of the thyroid gland. 10. What is Plummer's disease? Plummer's disease is a disease that causes goiter and hyperthyroidism. 11. Plummer's disease is also called toxic multinodular goiter. Chapter 3. 1. Can hyperthyroidism lead to atrial fibrillation? Yes, hyperthyroidism can lead to atrial fibrillation. 2. What is atrial fibrillation? Atrial fibrillation is an irregular and fast heart rate. 3. Can hyperthyroidism lead to osteoporosis? Yes, hyperthyroidism can lead to osteoporosis. 4. What is osteoporosis? Osteoporosis is a disease that causes decrease in bone density. 5. What is an important risk of osteoporosis? An important risk of osteoporosis is a bone fracture. 6. Can hyperthyroidism lead to vision loss? Yes, hyperthyroidism can lead to vision loss. 7. Can hyperthyroidism lead to thyrotoxic crisis? Yes, hyperthyroidism can lead to thyrotoxic crisis. 8. What is thyrotoxic crisis? Thyrotoxic crisis is a sudden overproduction of the thyroid hormone. 9. Can hyperthyroidism lead to stroke? Yes, hyperthyroidism can lead to stroke. 10. What is a stroke? A stroke is a block of blood supply to a part of the brain. Chapter 4. 1. A stroke is also called? A stroke is also called cerebrovascular accident. 2. Can hyperthyroidism lead to congestive heart failure? Yes, hyperthyroidism can lead to congestive heart failure. 3. What is congestive heart failure? Congestive heart failure is when the heart no longer pumps blood efficiently. 4. Is type 1 diabetes a risk factor for hyperthyroidism? Yes, type 1 diabetes is a risk factor for hyperthyroidism. 5. What is type 1 diabetes? Type 1 diabetes is a high blood glucose levels in the body due to the absence of insulin production. 6. Can taking excessive thyroid medications for hypothyroidism cause hyperthyroidism? Yes, taking excessive thyroid medications for hypothyroidism can cause hyperthyroidism. 7. What are foods that contain high levels of iodine? Foods that contain high levels of iodine are dairy products, milk, cheese, iodized salt, etc. 8. Can hyperthyroidism cause pregnancy complications? Yes, hyperthyroidism can cause pregnancy complications. 9. What are the pregnancy complications of hyperthyroidism? The pregnancy complications of hyperthyroidism include miscarriage, preeclampsia, premature labor, and premature birth. 10. How is hyperthyroidism diagnosed? Hyperthyroidism can be diagnosed by the person's medical history, a physical exam, blood tests, thyroid scan, thyroid ultrasound, etc. Chapter 5. 1. Can hyperthyroidism be treated? Yes, hyperthyroidism can be treated. 2. What are the treatments for hyperthyroidism? Treatments for hyperthyroidism are antithyroid medications, radioactive iodine, thyroidectomy, beta blockers, etc. 3. What is thyroidectomy? Thyroidectomy is the surgical removal of thyroid gland. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding hyperthyroidism.